mercy.
Come on back, peaceful.
Whoa, easy now.
I'm gonna be free or die.
I've been walking with my face turned to the sun. Weight on my shoulders, a bullet in my gun. Oh, I got eyes in the back of my head, just in case I have to run. I do what I can when I can, while I can for my people. While the clouds roll back and the stars fill the night, that's when I'm gonna stand up, take my people with me. Together we are going to a brand new home, far across the river. Can you hear freedom calling, calling me to answer? Gonna keep on keeping on. I can feel it in my bones.
You have made it 100 miles to freedom. Would you like to pick a new name to mark your freedom?
Paradigm.
Early in the morning, before the sun begins to shine, we're gonna start moving towards that separating line. I'm wading through muddy waters. You know I got a made up mind, and I don't mind if I lose any blood on the way to salvation. And I'll fight with the strength that I got until I die. So I'm gonna stand up, take my people with me. Together we are going to a brand new home, far across the river. Can you hear freedom calling, calling me to answer?
Good afternoon. My name is Mitzi K. Glass, and I'm a licensed clinical social worker, and I'll be presenting today and having a discussion about Minority Mental Health Awareness Month on behalf of the ARDX Foundation. July this month is National Mental Health Awareness Month. So what is Minority Mental Health Awareness Month? This month, July, reminds us of the fact that mental health affects everyone, regardless of race, color, gender, and identity. And in some things you read, it may also add age. These characteristics makes access to mental health treatment so much more difficult. Dr. Daniel Gillison has told us and reminded us that the effects of racism and racial trauma on mental health is real and cannot be ignored. So the theme this year for National Mental Health Awareness Month is You Are Not Alone. So this is a time for us to focus on, consider, and connect with the many, many, many people, for those who feel that no one is listening, that no one cares, and that no one understands their mental health journey and struggle. And for people of color, especially Black and Brown people, but also those who have ascribed to different gender preferences, feel often that no one is listening to their struggle. So the hope for National Mental Health Awareness Month is that no one, regardless of their struggle, is that they would feel alone. So a little history. So this is a picture of B.B. Moore Campbell, and some of you may know her. She's deceased now and has written many books, But she was the one who in 2008, the National Mental Health Awareness Month was named in her honor. And the United States House of Representatives announced July as Bebe Moore Campbell National Mental Health Awareness Month. The inspiration for Bebe Moore Campbell is her daughter. And this is a picture of her daughter, Mai. And some of you may be familiar with her. She's an actress. And Bebe Moore Campbell wrote a book called 72-Hour Hold. And I don't know if any of you have had an opportunity to read the book, but if you haven't, you should read the book, because what it really talks about is a young lady and her struggle with mental illness. And so Bebe Moore Campbell wrote the book, and her daughter was the inspiration for the book. Bebe Moore Campbell said that once her loved ones accepted the diagnosis for the entire family, but it took too long. And so the book really talks about the struggle with the family members accepting and understanding the mental health challenges of her daughter. And so she asked, can't we as a nation begin to speed up the progress and the process? And so she said that we need a national campaign, one, to destigmatize mental illness, especially a campaign that is targeted towards African Americans. And she wanted folks to know that it is not shameful to have a mental illness, and wanted people to get treatment and know that recovery is possible. So I thank her for her courage to be able to tell her story through this book. So here's the reality about mental illness in persons and populations of color. According to SAMHSA and the CDC, and this is results from 2017, that 3.5 million of young adults aged 18 to 25 had serious thoughts of suicide, including 8.3% of non-Hispanic Blacks and 9.2% of Hispanics. In 2017, we knew that 2.5 million young adults aged 18 to 25 had a serious mental illness, and that was including non-Hispanic Asians, Hispanics, and non-Hispanic Blacks. The most important part of this is that feelings of anxiety and other signs of stress may become more pronounced during a global pandemic. And people in some racial and ethnic minority groups may respond more strongly to the stress of a pandemic or crisis. And we learned this year during our pandemic. So let's talk a little bit about mental health disparities. We know that minorities are less likely to receive a diagnosis and treatment for their mental illness. They have less access to mental health services and often receive a poor quality of mental health care. And if you go to SAMHSA website, the CDC website, you can flesh out the specific statistics related to African Americans, American Indians, Asian Americans, Hispanics, and Pacific Islanders. COVID-19, you know, when I thought about National Mental Health Awareness Month maybe a year ago, and definitely 2 years ago, COVID-19 was not on our radar. No one knew or even thought about a pandemic. But COVID-19 really shined a light on the mental health disparities in people of color. And we understood, and we're still researching and still understanding even more how COVID-19 disproportionately affected people of color due to social, legal, and economic inequities. And that's from the Psychiatric Times in 2020. And so you say, well, what were some of the biggest issues that we learned in COVID-19? One is access. People of color had decreased ability to see a doctor or get treatment. So you say, well, why was that? Well, it's because of transportation, It's also where people actually live. It's also because of sometimes the education and not having the ability to access the information to get people to a doctor, to get people the treatment. We learned that people were getting treatment later. We also know that people were getting access to medication and or not getting access to medication. So of course that affected those people of color. The other thing that we learned from statistics and from research, and that we're still learning, is that stress and anxiety increase for people of color. So what can we do? What, as we think about minority mental health awareness, and for those who are listening to this conversation, you may be thinking, well, why is this important to me? And what can I do to address the disparities and also to address the access issues for people of color, and to access, to improve anxiety and depression and suicide among people of color? The first thing would be to start the conversation, to have the conversation about mental health and mental health issues in racial and ethnic minorities. We understand that when you have the conversation, when you're ready to ask those hard questions, when you're ready to tap into and to connect with people and to understand that people are actually having these struggles, and that many of them are being affected and feeling alone, but to really engage people. People want to talk. They want to tell their story. So when we start that conversation, and when we're willing sometimes to even talk about our own stress and anxiety as people of color, and talk about what it was like for us to be able to go through the pandemic, for instance, and to talk with people about what it felt like to have increased anxiety about what it was going to be like about joblessness and employment, and being able to feel economically sufficient, to be able to have those conversations, and people will join you in those conversations. The second thing is to be mindful of stigma and how it impacts receiving mental health services. In many communities, especially we know in communities of color, there is still a stigma attached to mental health issues and mental illness. There's still, I call it that secret, the hoarding the secret. No one wants to tell, no one wants to share, because the feeling I'm weak, or I don't have the capacity to deal with my anxiety or my sadness or my depression. But when we're mindful of the stigma, then that helps us, in my mind, to begin the conversation more. If we can start the conversation, it also removes the stigma. It normalizes it and gives people an opportunity to say, you know what, I'm having this struggle, and people are willing to listen. I think it is important to educate ourselves about how racism and injustice perpetuates disparities in mental health services. Again, the COVID-19 was one pandemic, but we also had a racial pandemic in this last year. And being able to understand that racism and systemic racism and injustice, it perpetuates disparities and makes it so much harder systemically for people to access services, but also how they feel when they are accessing services, how it feels to be vulnerable and to try to access services. And then once you access services through your pediatrician or through your primary care doctor, or wherever those places are that we go to access services, and then you're made to feel less than, to feel that you are weak because of your color, because of your gender preference. And those are things that we have to read about more and to know that they're real. And then I would challenge us to commit to be present and available to address the mental health issues of those that are different than yourself. What that means is being able to listen to people who may not have the same, may not be the same color as you, may not be this, have the same ethnicity as you, may not have the same privilege as you, but be willing, again, to have these questions, to be able to engage, and to be able to have the conversations. And I think it's important to have these conversations with compassion. I think it's important to have these conversations with care. I think it's important to have these conversations without judgment, and to know that when we reach out to people of color and help those persons feel that they're not alone, everyone wins in our society. I'd also like to just add that I am a pediatric social worker and work in a pediatric setting as a social worker and as a therapist. And again, being able to have these conversations with parents and with other family members is so important. So the change begins with me, and the change begins with you. I'd like to thank the ARDX Foundation for being able to have this conversation with you today. And hopefully we can continue to help persons feel that they're not alone, and to use July as that month to really think about minority mental health, but also not just July. July is just a month that has been designated, but these are conversations that we should be having all throughout the year to really change, make a difference, and change the conversation and the narrative about mental health in people of color. I thank you very much.
Flipping through all of these magazines, telling me who I'm supposed to be. Way too good at camouflage. Can't see what I am, I just see what I'm not. I'm guilty about everything that I eat. Feeling myself is a felony. Jedi level sabotage. Voices in my head make up my entourage. Cause I'm a black belt when I'm beating up on myself, but I'm an expert at giving love to somebody else. I need myself and I don't see eye to eye. Need myself and I. Oh, why do I compare myself to everyone? And I always got my finger on the self-destruct. I wonder when I love me is enough. I wonder when I love me is enough. Why am I always looking for a ride or die? Cause mine's the only heart I'm gonna have for life. After all the times I went and f***ed it up, I wonder when I love me is enough. Haters that live on the internet, live in my head, should be paying rent. I'm way too good at listening. All these